The AGS-Beers criteria is a critical list to help clinicians, to help providers decide what medications are high risk for older adults. In doing so, the list tells a lot of people what not to use, what to exert caution with, what to be concerned with. But that list, the Beers criteria, doesn't necessarily provide you with alternatives. A decision has to be made on your own that's specific to your patient.
So the AGS-Beers alternatives list is a list of both drug and non-drug therapies that people can use to treat common conditions in place of using a drug from the Beers criteria that they might otherwise think about using.
There are other things in the list that are very helpful for patients and caregivers. Some resources for them that can be educational and help them understand why a particular drug is a bad choice for them, and they should no longer be taking it if the case of it needs to be discontinued.
The AGS alternative list allows clinicians, those who care for patients, to consider non-pharmacological and pharmacological options for medications that are high risk.
Heard for many years that the Beers criteria basically tells people what they should not do, what drugs we should avoid in older adults. But it begs the question about what should we do to help older adults who have chronic conditions, symptoms, anything else. So what we try to do with this list is really to say, well, if we're going to tell you what not to use, we want to give you some recommendations about what you can do instead. So the alternatives list is organized by condition, and that's really in contrast to the Beers criteria, because the Beers criteria are organized by medication. You know, we say here's a medication, here's maybe when you should avoid it and why you should avoid it. But the alternatives list is really focused on conditions. So in that case, we say, well, here's a condition: insomnia, chronic itching, pain. And then here are the Beers criteria medications that are commonly used to treat that condition. But instead of using those drugs, here are the things you could do instead. And the reason we organize it that way is because we thought it would be most useful to sort of practicing frontline conditions.
So who is the list intended for? Our principal primary audience are primary care providers.
I've been looking forward to the alternative list. There was a list that was created back in 2015, and I often give lectures on appropriate prescribing, on polypharmacy, on medication management, and I'm able to state, if this medication is high risk, you should consider this alternative. Since that initial alternative list was created, a lot has happened. The Beers criteria has been updated multiple times, and now with the new Beers criteria from 2023, it will be really useful to help guide discussion, to help guide education, to create workflows of how to inform clinicians about deprescribing.